Hello, folks. A special edition of Burning Platform from Workday Rising in Moscone Center in downtown San Francisco. It's a real pleasure to have Yolanda Redmond today. She's VP of Supply Chain at VUMC. That's Vanderbilt University Medical Center. So I'll use VUMC. It's a lot easier. And that covers the whole procure-to-pay cycle. So I'm looking forward to that conversation. We also have Keith Lohkamp, Senior Director, Industry Strategy, covers the healthcare space. So welcome both of you. Hopefully you've had a good couple of days at Rising already. Obviously, VUMC makes the U.S. news honor roll every single year. Nashville's a great city. There's so much going for you. But why don't you tell us a little bit more about yourself and the health system you represent? Let's start with that.
Yeah, glad to be here today, Vinnie, and thank you for having me. I joined VUMC 11 years ago as their finance manager in supply chain, as well as some other auxiliary services, and moving into financial reporting and analytics for the finance team when an opportunity within supply chain came up as a result of a decision to separate and create two different entities between the university and the medical center. And with that, it gave VUMC the opportunity to create a procure-to-pay team. And for VUMC, that includes our sourcing and data analytics, our purchasing, accounts payable, processing and payment, our travel, employee reimbursement, credit card administration, as well as our supply chain systems team. So a real complete procure-to-pay perspective from a supply chain perspective.
So procure-to-pay is actually a very narrow definition. You do a lot more.
It is. It truly is. And with that, VUMC has had the opportunity to be able to collaborate by having those teams under one organization together. It creates the accountability and collaboration that we needed within that book of space.
So Nashville's a great city.
Mm-hmm.
Vanderbilt's are a storied American family. I bet you the U.S. News, every year you feel good about being mentioned in the honor roll. What else makes you proud about your company?
I love working at VUMC. One of the many things that I love about VUMC is the culture of actually putting the patient first and its employees. And it's not just a statement for VUMC, it's actually in VUMC's DNA. And it permeates throughout the organization in everything that we do and in everything that we try to achieve by making sure that we are serving our patients, our employees, and making that a high priority for us. It gives us a sense of ownership, as well as being committed to our colleagues and being able to be effective at communicating those things that are needed. Those are just a few of the things that I love about working at VUMC.
Yolanda, I was hoping you'd have some musical angle to the Friday. Keith, thank you for joining me. Why don't you talk about your role at Workday? And, we're going to talk a lot more about the healthcare industry, but talk about the role.
Well, what's so exciting about my role is getting to work with incredible customers like VUMC that really have this mission to take care of patients. And so I like to think that we're doing a small part of that. And so in my role, I'm responsible for the overall product strategy for the healthcare industry. So figuring out where we need to invest in the product, invest in partnerships, analytics, content integration, whatever it is, to try to make a comprehensive solution for our customers. I joined Workday just over 8.5 years ago after spending almost 10 years in charge of the product strategy for Lawson supply chain. So supply chain is really like a big passion of mine. One of the reasons I came to Workday was to help build a modern supply chain management product in the cloud as well, and really figure out how to take those lessons from the past and bring new capabilities as well. So I get to work with customers and prospects and work with our development team to really try to think about, how do we deliver solutions that are really going to tackle the challenges and really help support the mission of organizations like VUMC.
Between the two of you, you've used the word supply chain many times already. It means different things to different industries, right? I mean, as consumers, it's the Amazon supply chain. To some of them, it's the ocean freight from wherever, right? Yolanda, define in your terms when you talk about supply chain.
So from a supply chain perspective for VUMC, it's about ensuring that we have the right services and goods in place to be able to have at the right time what is needed to ensure that we have optimal operations, whether that be in our clinical areas where we're directly servicing our patients, or in our research areas, or even in our administrative areas. Every area of VUMC is important to us. And it's about the supply chain being able to help streamline that process where it can be very complex for an organization to work its way through. And it's also too about having an agile supply chain to be able to accommodate and be able to handle the different things that are currently happening in the supply chain space today.
So everything from PPE to lab stuff, very broad range of products and services, you said? So that's
yes,
pretty
that is correct.
Pretty comprehensive. So, I know we're going to talk about a lot of what happened during COVID and so on, but what would you say today, now that we're coming out of that, what would you say are your biggest challenges and opportunities in the supply chain area?
So for us, I think, and really across the board for all of the supply chain systems, it's about resiliency and availability of product, because with COVID, we have been introduced to a lot of back orders that have continued to plague our environment, and being able to respond to that. And then also too, from an economic perspective, being able to have a sustainment as it relates to the pricing of the products and the services that we're receiving, because ultimately that goes into the cost for the patient. And we want to make sure that we're being able to provide a cost-effective environment for them, for us to be able to offer the services that we do. And from a supply chain perspective, that is not just external, but it's also internal as well, and being able to pivot as needed to be able to support that supply chain. COVID's taught us a lot.
Yeah, and raise the expectations, right? You said resilience.
It does.
We cannot afford to have anything repeat, or at least not as dramatically as we just went through.
That is correct.
So that's your challenge, right? That is the Workday challenge that your customers are telling you. Make sure we don't fail. Make sure we can respond better than we did the last time. Given that, how is Workday responding?
Yeah, I mean, and it's really kind of a range of solutions. I think you heard from Yolanda a lot of sort of the day-to-day challenges, but then also thinking about how do they make the supply chain more resilient going forward. So, a lot of our investment over the past couple of years has been focused on, visibility, visibility into inventory, visibility into critical products, alert when things are getting shortage, but then tools to help better manage back orders. And we've put a lot of focus on helping to manage substitutes as well, being able to set those up and automate the substitute process, so that sort of that day-to-day dealing with the back orders that we're still experiencing. And then what we're also looking at is what are those tools we can give our supply chain management customers to further boost resiliency. And so that's investing in areas like demand planning to try to identify anticipated demand, maybe looking at either a category or looking at scheduled procedures and trying to forecast that out. So with better visibility in that, being able to better plan and anticipate where there might be potential shortages, or investing in things like analytics that can help with understanding utilization and maybe reduce the variation as well, and helping to get at actually reducing costs as well, And so particularly as you start thinking about the sustainment of price points, one of the ways that I think a lot of healthcare organizations have already pressed their suppliers a lot on this. And so it's looking for higher commitment, or it's looking for sort of those win-win scenarios to drive greater efficiencies within the supply chain.
And when you say substitute, is that substitute SKUs or substitute suppliers or all of it?
It could be both, and it's often substitute SKUs that have been set up to say, okay, we've gone through and anticipated if we're short on this, this is an acceptable product. I'm sure, Yolanda, you're also looking at not only if we do have to substitute, what's that clinical impact? Do we have to
That is correct.
communicate, these changes to the clinical teams? And that partnership between supply chain and the clinical teams is huge to the success of this as well.
So Yolanda, Keith went through a laundry list. You've implemented Workday. Tell me what you found most useful as you've gone through the deployment.
So Vinnie, we're actually very early into our implementation, but we have still already seen some synergies that have come from that implementation. We're still looking to make some enhancements, and then further, even down the road, continue to optimize as we look at all the many offerings that Workday has for us. We can see already the benefits of having a unified platform that Workday offers. And it's also a very much having real-time information, having data readily available to us on a single platform where we're not spending the time trying to consolidate that information from various sources. So Workday has been very good in that aspect. We're also learning how to team together, because being on that unified platform allows you to work very closely with other teams where you may have previously been in a siloed environment.
And your customers, your internal customers, what's the feedback you're getting from them? I mean, what metrics have you already been able to show, and what are they pushing you to show more of?
So some of the things that we're looking at from a metrics perspective, from a procure to pay perspective, it's about being able to actually place an order and place that order on time so that we can get it from our suppliers on time to be able to deliver the services or goods that are needed by our departments. It's also not just purchasing the products, but it's also paying our suppliers for the goods and services that we've received. So it's about timely payment, and Workday is allowing us to be able to facilitate that full cycle from end to end in order to, as I stated earlier, our main goal is our patients and our employees, and it helps to enable that.
So let's go back to probably not a very pleasant phase. I'm sure it's a memory you'd rather not bring up too often, but tell me about some horror stories and how you worked through them in COVID. Because I mean, it's always fascinating to hear of people who worked their way through crisis, right? And my God, you guys went through hell. So talk a little bit about that for a couple of minutes. I won't dwell on that too much. I know it's not a very pleasant phase in most people's lives.
It is, but with all things, there is opportunity, whether they be good or bad. We have to look for the opportunity. And for our supply chain team, one of the things that I'd say we faced was back in March of 2020, before COVID actually even came to VUMC. Our supply chain offices were hit by a tornado and they were destroyed. Not just our offices, but also our supply chain distribution center as well. And so our team had to quickly pivot to get employees into a new building to start working, as well as start supplying our medical supplies from a different distribution center in order to make sure that the hospital still had the things that they needed in order to care for our patients. Where we then quickly, just a couple of days after that tornado hitting, started to get our first COVID patients. And so we had to pivot again to make sure that the organization as a whole was able to respond to the needs of what was coming with COVID. And through all of that, we had to learn as well to work with a team that was primarily remote. We had previously all been in the office working together. So that was a new opportunity as well for us. And the teams really excelled through that.
You know, the expression, what doesn't kill you make you stronger?
Yes, definitely.
I'm amazed you're still smiling. You had a
Yeah.
double whammy and you came through that extremely well. Give me some more anecdotes from that, because this is really heartening to hear how you came through all that.
Yeah, it is. I mean, we're just really proud of the way the teams performed. And again, how the teams came together and worked. We can see the many benefits that we will have, that if we have another type of significant event such as that with Workday, we would be able to pull that data in as we need, understand where we need to pivot, how we need to change with the technology that we would be putting in place.
So Keith, healthcare is going through a lot of change, right?
Yeah.
I mean, a lot of players entering the market, at least the patient-facing market, consolidation in the provider space, payer space is continually evolving, and so on. The innovations that Workday is working on. What are you seeing in terms of real opportunities for the next few years?
Well, before I comment on that, first I'd like just to echo the heroic work that we saw healthcare providers and particularly supply chain teams make in terms of making sure that the products were there, they're able to deliver care, and just the way, at least we saw the healthcare community come together and share solutions and best practices and ideas. So everyone was there pulling for each other as well to make sure that they were successful. So that was just amazing to watch. But, kind of pivoting back to your question, it's really interesting to watch the industry continue. And healthcare has been evolving for a number of years. The expectations of the patients is really changing. And I think that for health systems, really trying to understand where, what are those expectations? Where do we need to deliver care? Where do we need to innovate to meet those expectations is really critical to continue to adapt to that. But we're also seeing, new entrants. So whether it's retailers or, traditional retailers or health insurance companies that are starting to get into home health or primary care, and sort of blurring those lines across those companies. And so for us, it's being able to have a platform that's very flexible to be able to adapt and change as organizations need to change. And so if you go back to time of COVID, many of our customers had to spin up now suddenly accelerate telemedicine and spin up, the resources to help support that. Or we have many customers that have health plans as well as being a provider and being able to run those businesses and be able to monitor and adjust. And so, we really believe in the flexibility of the platform to be able to innovate on that. And then we're also looking at new products like Accounting Center that was originally developed for the financial services industry. But we think it has a lot of applicability for healthcare. First off, for systems that may have their own plans and want to bring in detailed information about claims and payments. But also, we're seeing healthcare organizations use it to help streamline things like net patient revenue calculations as well. So, really trying to think about how can we use the platform in new and different ways as well, and letting our customers really also be able to experiment and see the art of the possible as well.
So picking up on what Keith said, Yolanda, you mentioned, not just purchasing stuff, but also making sure vendors got paid. And that's one advantage of having a unified platform, right? The visibility across the whole end-to-end process. Tell me some other examples where you've seen this unified platform help you.
I actually see it now because we previously come from many legacy disparate systems. There was a lot of opportunity to be working in a silo. Workday has helped to provide that not only unified platform, but also unification across multiple functions as well. Seeing what happens in an integrated environment not only impacts supply chain, but it also impacts finance. It's working with them, working with HR to help find solutions that is going to help not just supply chain, but VUMC as a whole. So that collaboration that Workday helps to enable has also been hugely beneficial to us as well.
Does that made your employees a little more cross-functional, a little broader in their scope of coverage, or is it still too early?
I'd say probably a little bit too early right now for us, but however, we're looking at it. I do like what I've seen here at the conference in regards to some of the potential opportunities that we may have in the future around that. I think with the right governance and framework that the possibilities could be endless in terms of what it is that we could do.
Well, talking about people, Yolanda, you've heard a lot about generative AI. Well, not just generative, predictive AI. I mean, the whole conference has been about AI, right?
Mm-hmm.
Certainly this morning. Are you excited about it? Are you scared by it? Give me your initial reaction to all that you.
I am excited about it. I love technology. I think that it does require structure in doing it. But I'm looking forward to what could be in the future for AI. I think that it is a very good path from a technology perspective to go through. And I think that from the human side of it is that it could provide great benefits to our teams as well.
Keith, what are you hearing from other customers about the AI direction you're showing them?
Well, I mean, so far the response has been really, really positive, and for a couple reasons. One, just a lot of excitement about being able to automate more processes as well. You know, have the machine help with find anomalies, help going through large amounts of data and sort of summarizing that for the end user. And they're excited about the fact that we're providing kind of a framework and an easy way to adopt as well. I think that for most organizations that are considering AI and ML, they're kind of going through that discussion about what are those rules, what's that governance structure. And with what we're building into our platform, we're giving kind of a framework, we're putting the responsibility around it, and then really allowing our customers to opt in and decide when is it the right time to do that. So, you know, we see our customers excited about us using it for OCR, using it for anomaly detection. And I think the big one that as we start looking for in the future is how do we use that to help make predictions, particularly when it comes to things like demand planning as well.
You know, Yolanda, I go to a number of these conferences, and I decided when I came here, I would just note down all the use cases they talked about. And just in a 1 hour segment, I noted about 50 use cases. So this is going to be an explosion, I think. It's going to be a question of prioritization, I think, for a lot of organizations.
Yep.
But Yolanda, so we are now on day 2 of Rising. Tell me what else you've, other than learning a lot about AI, what else has been, where's the payback? New contacts? Beating up on people like Keith and saying, I want more? Tell me what the payback is.
Well, I mean, you're right. We're actually only on day 2. And I say only on day 2 because it has been content rich for me. The educational opportunities that have been here at Rising, as well as the networking that we've been able to do, hearing about other members in the community, in the Workday community, and their experiences, some of the things that they're doing, just it completely excites me around what we can do with Workday. And like I say, we're only on day 2, so I can't imagine what else I'm going to hear the rest of the conference. So definitely looking forward to it. Everyone should come to Workday Rising.
So we heard a lot of very impactful points, right? Unified platform, demand forecasting. I mean, it covered so much ground. I'm going to let each of you spend a minute and kind of put some final thoughts, things you may not have had a chance to express about. Yolanda?
I would like to say, Vinnie, that I'm actually very optimistic about where we're going, the partnership that we're forming with Workday and the community as well of Workday, and the capabilities that I see not only here at Rising, but also what I see from Workday as a whole and their commitment to being able to provide us and enable us to do the things that we need to do in order to be successful.
Keith?
Well, I would just really echo the partnership with our customers and the power of community. You know, I talked about a lot of features, functions, but none of this happens without the partnership and commitment of our customers. From the very beginning when I joined, we knew the only way we'd be successful in healthcare is by partnering with our customers and building the strong community and learning from them and learning from their priorities, and things like Workday Rising, it just sort of amplifies and shows the power of that community and the power of the healthcare community, but also the broader community of partners as well that are helping to really solve these key challenges that healthcare faces, which, you know, it makes me really optimistic about our ability to continue to support our customers and help them get through the challenges that are inevitably going to happen. But it seems like they're ready to face a lot of those challenges.
Well, Yolanda and Keith, thank you so much. We covered a lot of ground, only on the supply chain side. I'd like to bring you back in a few years and talk about Workday's EHR. How about that? Wouldn't that be fun? Wouldn't that be a fun journey? No, seriously. Thank you so much, both of you, and enjoy the rest of Rising. And I will bring you back periodically. Don't mind. This is always fun to have people come in and talk about their experiences. And Yolanda, I need to come visit your city again. I've been spending a lot more time in Austin. Yours is a better musical town.
It is.
I haven't done it justice. So thank you again.
You must come to Nashville.
Will do. And invite all the viewers of this.
Yes.
Thank you.
Thank you.